If you happen to have high blood pressure, you might wonder if you need to take medication to lower the readings. However, changing one's lifestyle is crucial to managing high blood pressure. Maintaining blood pressure control by a healthy lifestyle may eliminate, postpone, or minimize the need for medications. Therefore, we are back with another video on maintaining control of your blood pressure and preventing high or low blood pressure. Weight control. Watch your waistline and drop the additional weight. Weight gain frequently causes an increase in blood pressure. In addition to raising blood pressure, being overweight can lead to sleep apnea, which disrupts breathing while you're asleep. One of the best ways of life adjustments for lowering blood pressure is weight loss. Even a minor weight loss can help lower blood pressure if you're obese or overweight. In general, each kilogram or 2.2 pounds of weight dropped may result in a reduction of blood pressure of roughly 1 millimeter of mercury. The width of the waist is also crucial. High blood pressure risk can be increased by carrying too much fat around the waist. Regulate stress levels. Chronic or long-term emotional stress may be a factor in high blood pressure. To determine whether stress management practices help lower blood pressure, more study on their effects is required. Determining the sources of stress, such as employment, family, finances, or sickness, and coming up with strategies to lessen stress can't hurt either. Try these things. Do not attempt to do too much. Concentrate on your priorities and make a plan for the day. Say no more often. Give yourself adequate time to complete your tasks. Take small steps. Make preparations to address the problems you can manage by concentrating on them. Speak to a supervisor about a problem at work. Find solutions to conflicts with your spouse or children. Keeping away from stressors. Take public transportation or travel at a different time if, for instance, rush hour traffic stresses you out. If you can, stay away from stress-inducing folks. Schedule some downtime. Every day, set aside some time to relax and breathe deeply. Make time for fun pursuits or hobbies like walking, cooking, or charitable work. Exert thankfulness. Being grateful to others can make you feel less stressed. Regular exercise. Physical activity on a regular basis can reduce high blood pressure by 5 to 8 millimeter Hg. To prevent blood pressure from increasing once more, it's crucial to continue exercising. Aim for at least 30 minutes of medium level of physical activity each day as a general objective. Exercise can also prevent high blood pressure from developing in those with raised blood pressure or hypertension. Regular exercise can help people with hypertension lower their blood pressure to a safe level. Walking, jogging, cycling, swimming, or dancing are some forms of aerobic exercise that can lower blood pressure. High-intensity interval training is another option. Short bursts of intense exercise are interspersed with slower intervals of activity during this form of training. Additionally, strength exercise helps lower blood pressure. At least twice a week, try to include strength training activities. Consult a healthcare professional to create an exercise plan. Sleep is important. You should get a restful night's sleep because receiving less than 6 hours of sleep each night for a few weeks can increase your risk of developing hypertension. Numerous conditions such as sleep apnea, restless leg syndrome, and general insomnia can interfere with sleep or insomnia. If you frequently have difficulty sleeping, let your healthcare professional know. Sleep quality can be increased by identifying and treating the problem. To achieve more comfortable sleep, however, if you don't suffer sleep disruption or restless leg syndrome, try these easy suggestions. Respect a sleeping pattern. Set a consistent bedtime and wake-up time each day. On weeknights and weekends, make an effort to maintain the same schedule. Make a peaceful environment. This calls for maintaining a cold, calm, and dark sleeping environment. Spend the hour before going to sleep resting. This could be taking a warm bath or practicing relaxation techniques. Refrain from using bright lights like those from a TV or computer. Pay attention to what you consume. Don't overeat or go to bed hungry. Avoid eating a lot right before bed. Alcohol, caffeine, and nicotine should all be restricted or avoided right before bed. Take only brief naps. Limiting napping to 30 minutes early in the day may improve evening sleep for people who find taking naps throughout the day to be beneficial. Limit your alcohol consumption. It is possible to reduce blood pressure by roughly 4 mmHg by limiting alcohol consumption to fewer than 1 drink per day for women and 2 drinks per day for males. 12 ounces of beer, or say 5 ounces of wine, or 1.5 ounces of an 80-proof liquor constitute 1 drink. However, consuming too much liquor can cause a significant increase in blood pressure. Additionally, it may lessen the impact of blood pressure drugs. Eat a balanced diet. A diet low in saturated fat and cholesterol and high in whole grains, fruits, vegetables, low-fat dairy products can reduce high blood sugar by up to 11 mmHg. The Mediterranean diet and also the dietary strategies to stop hypertension or DASH diet are 2 examples of eating regimens that can lower blood pressure. Salt or sodium's effects on blood pressure can be lessened by potassium in the diet. Foods like fruits and vegetables are better providers of potassium than supplements. Aim for 3,500 to a maximum of 5,000 milligrams per day, which may result in a 4 to 5 mmHg reduction in blood pressure. To find out how much potassium you need, talk to your doctor. Get assistance. Strong social networks of family and friends are crucial for health. To keep your blood pressure low, they might motivate you to take care of yourselves, drive you to the doctor's office, or start an exercise regimen with you. Think about joining a support group if you discover you need assistance beyond what your family and friends can provide. This might put you in touch with individuals who might encourage you emotionally or morally, and who can provide you useful advice on how to manage your disease. How to avoid blood pressure fluctuations. While a small amount of variation in blood pressure is expected throughout the day, severe swings in blood pressure need to be watched for and treated. Blood pressure can be controlled by natural therapies, lifestyle modifications, and some pharmaceuticals. A person should have their blood pressure checked by a medical practitioner on a regular basis because blood pressure can tell a lot about a person's health. The following activities can support blood pressure normalization. Giving up smoking. Smoking can raise blood pressure and damage the arteries. Consuming more veggies, fruits, healthy grains, and protein foods, processed foods, and processed sugars should be reduced or eliminated. Consistent exercise. The American Heart Association advises moderate intensity activity, such as brisk walking, at least 5 days a week for 30 minutes each, should be dedicated to this. Limiting alcohol. Women should consume no more than 1 drink per day, and men no more than 2 drinks per day. More than this can cause blood pressure to increase. Finding healthy ways to reduce stress. Blood pressure spikes can be avoided by practicing meditation, breathing exercises, guided visualization, and other stress management strategies. Less sodium intake. Foods that are overly salty might cause sudden spikes in blood pressure. Lowering caffeine intake. Caffeinated beverages can temporarily raise blood pressure and may exacerbate anxiety. Why it's important to monitor your blood pressure? The body can be destroyed by hypertension even before any serious symptoms show up. Therefore, routine examinations are a must. This is the reason why medical professionals advise their patients to take their blood pressure throughout the day. It is the only method for detecting hidden hypertension. Patients with this illness have high blood pressure at home, however normal blood pressure when they visit the doctor. Without knowledge of our own situations, we cannot take any action to treat hypertension. Doctors encourage everyone to have their blood pressure checked at least once a year for this reason. Additionally, they ought to discuss stress, heart or renal disease, a family medical history of increased blood pressure, and any other potential aggravating factors with their primary care physician. You can control your blood pressure by working together. That is all we have for today, guys. We hope this helped you in some way. Remember these points and do not forget to look after yourselves. Stay healthy, everyone, and we hope to see all of you soon. Drop a like and stay tuned for the next one.